Welcome to the deep dive. Today, we are plunging into, well, a really critical and frankly quite grim topic: phosphide rodenticide toxicosis in animals.
Yeah, it's a tough one.
To help us navigate this, we've got a range of sources you sent over, some very detailed clinical guides for the specialists, and also some more basics type overviews.
Right, a mix to pull from.
And our mission here really is to cut through all that technical detail and pull out the most vital pieces of information. Kind of a shortcut, to getting properly informed on this specific and really dangerous type of poisoning.
It's the kind of knowledge that could genuinely make a difference.
Absolutely.
And understanding this poisoning is so important because, well, like the sources point out, it's really different from a lot of common ones. Phosphides are incredibly potent. They act frighteningly fast.
Right.
And the mechanism is unique. It actually creates a toxic gas inside the animal's body.
A gas. Wow.
Yeah, and that gas isn't just bad for the pet. It's a direct risk to anyone nearby, anyone caring for the animal.
Yeah.
Add to that the fact there's no specific antidote.
No antidote.
None. So you can see why the mortality rate is, unfortunately, very high if you don't jump on it immediately, like really aggressively.
Okay, let's unpack that. So starting at the beginning, what exactly are these compounds and what makes them so uniquely nasty?
Well, at their core, they're metal phosphides. Usually zinc phosphide, that's the most common one you'll see.
Zinc phosphide? Okay.
But sometimes aluminum phosphide or magnesium phosphide turn up too.
And the sources highlight something pretty worrying about how they look, right? How you might actually find them.
Exactly. They're typically sold as these little gray or black pellets, or sometimes a meal, or even a powder.
And the kicker?
The kicker is they can look almost exactly like common animal feed ingredients.
Oh, that's bad.
Yeah, that visual similarity is a huge part of the risk. Concentrations are usually somewhere between, say, 2% and 10%.
And where are people typically using these?
Often in agricultural settings, around farms, barns, fields,
Hmm.
or for controlling pests like moles and gophers in outdoor areas.
So places where pets, especially dogs, might easily stumble upon them.
Precisely, which leads right into how they get exposed.
Right. How does it usually happen?
The most common way, by far, is just direct ingestion, eating the bait.
And dogs are the main victims.
Sadly, yes. Often because they're curious, they explore with their mouths. They tend to eat things first, and we'll figure out later.
Yeah.
The sources do mention secondary poisoning is possible, like a cat eating a mouse that ate the bait.
Okay.
But direct ingestion is much, much more common.
Okay, and you mentioned the gas. This sounds like a critical safety point.
It absolutely is. This is non-negotiable. The compound itself reacts to release a highly toxic gas. It's called phosphine, pH3.
pH3.
And this gas is not just toxic if ingested. It's dangerous to people just by breathing it in. Inhalation hazard.
Wow. So if an animal's been exposed?
Ventilation becomes absolutely crucial. You need extreme caution handling affected animals, especially if they're vomiting. That vomit can literally be releasing poisonous gas into the air around you.
That's incredibly serious. Okay, so let's get into the mechanism. This is where it gets really interesting, you said. It's not just swallowing poison, it's what happens inside.
Exactly. Think of it like a chemical bomb waiting to go off. When those phosphide compounds hit the stomach, they mix with water and the stomach acid, hydrochloric acid, HCl.
Which is naturally there, obviously.
Right. It's a very acidic environment. And in that acid bath, the phosphide undergoes hydrolysis. It breaks down rapidly and violently.
And the result is?
The main byproduct is that phosphine gas, pH3, highly toxic.
Okay. And you said the amount of gas depends on the acid.
Directly tied to it. More acid means a faster, potentially bigger reaction. And this is key.
What stimulates acid production?
Food in the stomach.
Ah.
So if an animal eats this bait on a full stomach, it might actually experience a faster and more severe onset of signs because there's more acid ready to fuel that reaction.
So feeding a pet after you suspect ingestion is a terrible idea?
A terrible idea, but the sources are really clear on that. Don't feed them. You're essentially pouring gasoline on the fire.
That's a critical takeaway. Wow. Okay, so the gas is made in the stomach. What happens then? Where does it go?
It gets absorbed really quickly, right from the GI tract into the bloodstream. And then it circulates around the body. It tends to concentrate in organs that use a lot of energy, like the liver and the lungs.
And once it gets into the cells in those organs, what kind of damage are we talking about?
It's complex, down at the cellular level, but the sources point to a few main things. First, mitochondrial dysfunction.
The cell's powerhouses.
Exactly. Phosphine basically messes with the enzymes needed to make ATP, the cell's energy currency. It just shuts down the power supply.
Crippling the cell.
Right. Second, it triggers the formation of free radicals. These are damaging molecules that cause oxidative stress, lipid peroxidation. Basically, they cause cells to rust and fall apart from the inside.
Passy.
And third, the gas itself is corrosive. It directly burns the sensitive lining of the GI tract as it's being absorbed.
Okay, so summing that up, no power, cells getting damaged by free radicals, and the gut lining is literally burned. What does that look like in the animal?
Well, it translates to rapid, widespread problems. Multisystemic dysfunction. Because cells everywhere are struggling for energy, getting damaged. You see signs hitting multiple organ systems and often very, very quickly.
And you mentioned that speed earlier. How quickly are we talking?
Yeah, the sources really hammer this home. Signs usually pop up within minutes to maybe a few hours, often just like 1 to 4 hours after they eat it.
That fast.
That fast. Sometimes, yeah, it can be delayed maybe up to 18 hours, but that's less common. And once the signs start, things can go downhill incredibly fast.
So walking through those signs, it often starts with the gut, you said.
That's very typical. Severe vomiting is a big one, often projectile, like forceful, repetitive, and it might even be bloody.
Like grim.
But here's that crucial detail again, mentioned over and over the sources, something you have to be aware of. The smell. A characteristic odor, often described like garlic or maybe decaying fish.
Garlic or fish.
Okay, you might smell it on the animal's breath or in the vomit itself. This smell is a vital clue for diagnosis, potentially life-saving. And it's also that immediate warning sign about the human risk from the gas.
That smell is doing double duty then, clue and warning. What other gut signs?
You might see severe abdominal pain, bloating, diarrhea, which could also be bloody, and just complete refusal to eat, anorexia.
And as the damage spreads beyond the gut.
Right, as that cellular damage takes hold elsewhere. Respiratory signs are common, often because of something called non-cardiogenic pulmonary edema.
Fluid in the lungs, but not from the heart.
Exactly. The gas damages the lung tissue directly. So you see rapid breathing, tachypnea, difficulty breathing, dyspnea. You might hear crackles if you listen to their chest.
Okay.
And it can progress to ARDS, acute respiratory distress syndrome, which is, really severe lung failure.
And the heart and circulation.
Also hit hard. You'll often see weakness, collapse. Their gums might look pale because circulation is poor. Heart rate can go way up, tachycardia, or sometimes way down, bradycardia. Low blood pressure, hypotension is common, leading to shock.
So systemic shock.
Yeah, and there's evidence of direct damage to the heart muscle itself, making it harder for the heart to pump effectively. Decreased inotropy.
Neurological signs, too, I think you mentioned.
Definitely. It can be a real mix. Sometimes they start out agitated, maybe aimless running, restlessness, but then that often shifts to depression, muscle tremors, wobbliness, ataxia.
Ataxia, okay.
They might become super sensitive to touch, hyperesthesia, and then seizures are a big concern, convulsions, leading potentially to stupor, coma.
Wow. It really hits everything. Any other specific effects the sources mention?
Yeah, a few other things can pop up. Methemoglobinemia, that affects how blood carries oxygen. You might see Heinz bodies on the red blood cells, maybe even hemolysis, where red cells break down. Acute kidney injury can happen. Liver damage, too, though the blood tests for liver enzymes might take a few days to really climb. And metabolic acidosis, a serious imbalance in blood pH plus other electrolyte problems, are very, very common.
So, with this huge constellation of severe rapid signs, how do vets actually pin this down, especially when time is so critical? The sources said it's tough.
It really is, and they're clear on this.
Yeah.
There's no single quick, bedside test that definitively says, yes, it's phosphide before things get really bad, or sometimes even after death.
So what's the most important tool then?
History. A detailed history from the owner is, according to these sources, the single most critical diagnostic tool you have.
Makes sense.
You have to ask immediately about any potential access to rodenticides, especially the kinds used outdoors, moles, gophers, farms. Ask right away.
And get the packaging.
Absolutely crucial. Ask the owner, plead with them if you have to, bring in any leftover bait, any packaging. Identifying the product is key. Also, noting that super rapid onset of signs helps differentiate it from, say, anticoagulant baits, where bleeding takes days.
Right.
And you have to specifically ask, did you notice that weird smell, that garlic or fish odor? Because that is such a strong indicator.
So history's number one. What about the physical exam itself? What are vets looking for?
The exam helps gauge severity, right? Checking vital signs, heart rate, breathing, temperature, blood pressure if they can get it, feeling the belly for pain or bloating. listening carefully to the lungs for those crackles, assessing their neurological status. Are they alert, twitching, seizing,
And checking for the smell again.
and constantly being alert for that characteristic odor on the breath?
Okay. What about lab work, blood tests, things like that?
Labs are definitely supportive, but usually not specific enough for super fast diagnosis on their own. Blood work might show those elevated liver enzymes, ALT, AST, bilirubin, but remember that can take 3 to 5 days sometimes.
Oh, okay, delayed.
Yeah. You might see electrolyte problems, low potassium, low magnesium, and that metabolic acidosis shows up pretty reliably on blood gas. On the CBC, the blood count, you might see signs of methemoglobinemia, those Heinz bodies, maybe red cell damage.
And clotting tests.
This is actually a helpful clue. Coagulation tests like PT and APTT are typically normal early on.
Normal.
Yeah, normal clotting,
Mm.
which is useful because it helps rule out the common anticoagulant rodenticides, which cause bleeding problems.
Got it. That's a useful differentiator. What about imaging? X-rays.
Chest x-rays can be very helpful to look for that pulmonary edema, the fluid in the lungs. Abdominal x-rays. Very rarely you might actually see little flakes of the phosphide bait, which are radio-opaque, but usually you just see a lot of gas build up in the gut.
Not super specific, then.
Not usually, no.
Hmm.
The definitive diagnosis, the actual confirmation, usually relies on detecting the phosphine gas itself.
But you said there's no quick test for that.
Right. It needs specialized labs. They use techniques like gas chromatography or maybe Draeger tubes. You need samples of stomach contents or vomit or tissues like liver or lung, often collected after death, unfortunately.
And you have to handle those samples carefully.
Critically important point from the sources. Samples must go into airtight containers immediately. That gas is incredibly volatile. It'll just disappear into the air if the container isn't sealed tight.
Makes sense. The sources also mentioned a few other possibilities, right? Things that could look similar initially.
Yeah, differential diagnoses, other really acute poisonings like strychnine or metaldehyde slug bait, severe sudden gut inflammation, gastroenteritis, pancreatitis, even acute heart failure or a sudden neurological crisis could present with some overlapping signs initially.
So, still need to keep an open mind, but that history and smell are huge pointers.
Exactly. They highlight why you do a workup, but often, given the speed and severity, treatment has to start based on strong suspicion.
Okay, so let's say you have a suspected case. The signs are hitting hard and fast. What's the treatment approach? The sources were very clear. No magic bullet here.
That's absolutely right. The single most important thing to grasp about treatment,
Yeah.
there is any specific antidote. Nothing you can give to directly counteract the phosphine.
So what is the goal then?
The goal is purely aggressive, intensive, supportive care. It's all focused on a few things. Decontamination, getting rid of any remaining phosphide, trying to minimize any further gas production, and just managing the absolute chaos the gas causes across all the body systems.
And before you even touch the animal, safety first.
Paramount. Absolute paramount. The sources stress this again and again. Human safety. Any procedure-inducing vomiting, pumping the stomach, even just handling the animal or cleaning up vomit must be done in a really well-ventilated area.
Like outdoors.
Ideally outdoors, yeah. Or under a proper fume hood, if a clinic has one. Staff need PPE, personal protective equipment. Gloves, absolutely. Respiratory protection, like a proper mask rated for chemical vapors, depending on how bad the off-gassing might be. Eye protection.
Isolate the patient, too.
Ideally, yes. Keep them in a separate, well-ventilated space to minimize exposure risk to other patients and staff. The sources even specifically mentioned telling owners to drive the car windows wide open on the way to the clinic.
Wow, that really drives home the risk.
It's serious. This gas is no joke for humans either.
Okay, so safety first. Then, focusing on the animal decontamination, what are the steps? They have to be fast, right?
Super fast and aggressive. First option might be inducing vomiting, emesis.
When would you do that?
Only if the ingestion was very recent, like within the last hour, maybe two. And the animal has to be basically asymptomatic or maybe just showing super mild signs. Critically, they can't already be vomiting constantly or seizing or unconscious or have any issues protecting their airway.
And you have to do it carefully because...
Because inducing vomiting can actually release more phosphine gas from the stomach contents. So again, only in that well-ventilated area.
Right. What if vomiting isn't an option?
Then gastric lavage, basically pumping the stomach, might be considered, especially if they ate a lot or if vomiting is just too risky for that patient.
Same safety rules apply.
Same safety rules. Well-ventilated area. And here's another absolutely critical detail from the sources about the fluid used for lavage. Do not use acidic solutions.
Because acid makes the gas.
Exactly. You just make the problem worse. Instead, you use alkaline solutions, things like dilute sodium bicarbonate baking soda solution, or maybe liquid antacids containing aluminum or magnesium hydroxide or calcium carbonate.
Right, alkaline.
The goal is to neutralize the stomach acid that's already there and raise the pH. Make the stomach environment less acidic to try and shut down that gas-producing reaction.
Actively changing the chemistry
Clever.
after you've washed out the stomach.
Then activated charcoal, usually given as a slurry.
What does that do?
It acts like a sponge, helps bind up any remaining phosphide particles that didn't get washed out, and maybe absorb some of the gas dissolved in the stomach fluids. You give about 1 to 2 grams per kilo of body weight.
Assuming the animal can take it safely.
Yeah, only if they're stable enough, not at risk of inhaling it. And the sources generally advise against using cathartics, things that speed up gut transit time.
Okay, so get it out, neutralize the acid. What about managing the acid long term?
Also crucial. You continue giving medications to control stomach acid. Antacids, like aluminum hydroxide, are given right away and then repeatedly to keep neutralizing acid. And acid reducers are started too, H2 blockers like famotidine or proton pump inhibitors, PPIs like omeprazole. These actually decrease the stomach's ability to produce acid in the first place.
Two-pronged attack on the acid.
Right. And because that gas is corrosive, you also use GI protectants. Things like sucralfate, which forms a protective layer over the stomach lining, or maybe ciprostol, helping the damaged gut lining heal.
So stop the reaction, protect the gut. But what about all those other systemic effects? The shock, the breathing problems, seizures.
That's where the really intensive supportive care kicks in. It's basically life support. 4V fluids are essential to combat shock and support circulation, but you have to be careful.
Because of the lungs.
Exactly. Monitor very closely for fluid overload because that pulmonary edema is a huge risk. Oxygen therapy is almost always needed for the breathing difficulty.
What if oxygen isn't enough?
If the lung damage is severe, if they develop ARDS, they might need mechanical ventilation, a breathing machine.
Wow, okay. Cardiovascular support.
Yep. For low blood pressure, they'll use vasopressors, drugs like dopamine or norepinephrine, to help squeeze blood vessels and raise pressure. If the heart rhythm is abnormal, antiarrhythmic drugs are needed.
And the seizures.
Need aggressive control with anticonvulsants. The sources mentioned benzodiazepines like diazepam or midazolam first, then maybe phenobarbital, levetiracetam, or even a continuous infusion of propofol if seizures are really refractory.
Okay. What about specific organ support? Liver, kidneys.
Yeah, they often add things aimed at supporting potentially damaged organs. Liver protectants like samin or silymarin, which is milk thistle extract. Sometimes vitamin K1 if liver function is really compromised. N-acetylcysteine, or NAC, is often used. It's an antioxidant, helps with methemoglobinemia.
And monitoring electrolytes.
Constant monitoring and correction are needed, especially for that severe metabolic acidosis. Pain management is also important, usually opioids or tramadol. The sources specifically say avoid NSAIDs like Rimadyl or Medicam because of the risk to kidneys and the already damaged GI tract.
Right.
And then just general nursing care, keeping them warm, nutritional support if they can't eat for days. It's a huge, multifaceted effort.
It really sounds like it. Just throwing everything you have at it. Given that massive effort, what's the bottom line? What did the sources say about the prognosis, the likely outcome?
Honestly, it's generally guarded to poor.
Guarded to poor. Why so grim, even with all that care?
Because if those severe signs develop, the vomiting you can't stop, the really bad respiratory distress, deep shock, seizures that just won't quit, coma, if those happen, the mortality rate is incredibly high.
Even with treatment?
Even with the best treatment. Death can happen very quickly, sometimes just hours, or maybe over a few days.
Is there any hope? Does early treatment help?
Yes, that's the one potential bright spot. The sources say the prognosis is more variable, maybe slightly better for animals that only show mild signs. Or, crucially, for those that get very fast, very aggressive decontamination right at the beginning, before a significant amount of that phosphine gas gets absorbed.
So time is absolutely everything.
Absolutely everything. Minutes matter.
And if they do survive the initial crisis, are they out of the woods? Any long-term problems?
Yeah, survivors aren't necessarily completely okay. The sources note they can have residual organ damage, particularly lingering issues with the liver or kidneys, or even the heart muscle.
So follow-up is needed.
Definitely. Which leads to monitoring. Any symptomatic patient needs really intensive care and monitoring, checking all those systems for at least 48 hours, or basically until the life-threatening stuff is clearly resolved.
What about animals with known exposure but no signs yet?
Even those, the asymptomatic ones, need close observation for at least 12 to 18 hours, just in case those delayed signs pop up.
Okay, so summing up the treatment and outcome. It's incredibly intensive, often unsuccessful if signs are severe, and recovery can be incomplete, which makes prevention.
The absolute cornerstone. Given the high fatality rate, the lack of an antidote, prevention is far and away the most critical strategy.
What are the key prevention points from the sources?
Pretty straightforward, really, but vital. The strongest advice is just don't use phosphide rodenticides where pets or other unintended animals might possibly get access. Full stop.
If people do use them,
Then secure storage is paramount. Lock it up, make it completely inaccessible. Using proper tamper-resistant bait stations can help minimize accidental exposure rather than just scattering bait.
and supervising pets.
Supervising pets closely in high-risk areas, farms, fields, areas known to have gopher problems, and maybe discouraging pets from hunting or eating rodents, though again that secondary poisoning route is less common than them eating the bait directly.
And the final piece seems to be owner education.
Huge, really huge. Making sure clients understand just how incredibly dangerous these specific products are, how fast the signs come on, teaching them about that specific garlic or fishy odor as a massive red flag.
Prompting them to act fast.
Exactly. Emphasizing the need for immediate veterinary attention, don't wait and see. And critically, making them aware of the very real human health hazard from the gas. Getting that message out is probably the single best tool we have to prevent these tragedies.
Okay, so let's bring this all together then. Key takeaways.
Yeah.
Phosphide toxicity is terrifyingly fast, incredibly severe. It's driven by a dangerous gas produced inside the body. There's no antidote. Treatment is all-out supportive warfare, basically. And it poses a significant risk not just to the pet, but to the people trying to help. Prevention really is everything.
Exactly. And if you think back to why we dug into this, understanding the why of it all, how that simple acid reaction makes the gas, how the gas then shuts down cellular energy and causes damage, it suddenly clicks why the signs are so rapid and widespread. It explains the specific treatments, like using alkaline washes to stop the reaction or acid reducers.
Right.
And knowing about that specific odor isn't just trivia. It's a vital piece of the puzzle that can trigger immediate, potentially life-saving action, and also trigger that necessary caution for the humans involved.
That really leads to a final thought, doesn't it? Thinking about that unique double-edged sword, the danger to the animal and the danger the sick animal poses back to its caregivers through that gas. How does understanding this specific hazard maybe shift how you think about preparing for any emergency? Does it make you consider not just what does the patient need right now, but also what are the risks in this immediate environment, including risks to me? It's definitely something worth mulling over.